Good morning, good afternoon, and good evening. Welcome to all of you to this side event, which is part of the 14th session of the UN Conference of State Parties to the Convention of the Rights of Persons with Disabilities. The title of this side event is The Impact of the COVID-19 Pandemic on Persons Affected by Leprosy and with leprosy-related disabilities and the fight to defeat leprosy. It has been organized by the Leprosy Mission and Disabled Peoples International. We have sign language interpreters working with us today who are interpreting in American Sign Language. We also have a live captioner with us today, and you can see in the chat the link to access that. We are incredibly grateful for their support. We hope that with their help and by activating the live captions at the bottom of your screen, everyone will be able to follow our conversations over the next hour or so. By ways of introduction, my name is Mathias. I am the Global Advocacy Manager for the Leprosy Mission International. And I also chair the advisory panel of persons affected by leprosy at ILEP, which is the International Federation of Anti-Leprosy Associations. For your information, this side event is being recorded and will be available at a later time, and we will provide details as to where and how you can access it. If you would like to tweet about this event, and we would certainly want to encourage that, you can use the hashtag leprosy after COVID. Leprosy, or Hansen's disease, is still very real, and about every 2 minutes, a person in the world is diagnosed with leprosy. It is estimated that about 4 million people live with a leprosy-related disability in the world. Unfortunately, this cannot be confirmed since the data is not being collected. Leprosy has often been seen as a purely medical condition. Persons who have experienced leprosy and with a leprosy-related disability have not always been part of the disability community. For this reason, we are very pleased to be working with Disabled Peoples International to ensure that people who have experienced leprosy are included in the wider disability movement. The object of this event is to discuss how the COVID-19 pandemic has impacted persons with leprosy-related disabilities and the overall fight to defeat leprosy. We know that the pandemic has created additional challenges, both for persons affected and for other people who are also working to defeat leprosy. We also want to discuss how the UN CRPD framework can support persons who have experienced leprosy in addressing and overcoming their challenges. Today, we will hear directly from persons affected by leprosy and leading leprosy experts on the impact of the pandemic on their lives and the fight to defeat leprosy. The socioeconomic impact of the pandemic on marginalized, disadvantaged, and fragile communities has been disproportionate. Persons affected by leprosy have not been exempt from that. Loss of livelihoods and incomes have led to unemployment. Meanwhile, leprosy-related disability will grow significantly due to the pandemic. We will invite persons affected by leprosy-related disabilities to speak about their experiences of the pandemic and what the post-COVID future holds for them. We have a panel of 7 speakers, and 5 of those have experienced leprosy themselves. I'm going to invite each of those panelists to speak, and after all the panelists have spoken, we will open up for a time of questions. If you would like to ask a question of the panelists, please add these to the Q&A box, and we will do our best to have your questions answered. I would like to introduce now Dr. Indra Napit. I hope I'm saying that right. Dr. Indra is a longtime servant of the Leprosy Mission and is the senior orthopedic and reconstructive surgeon at Anandaban Hospital in Nepal. He is the principal investigator of the RIGHT project, which is looking at how we can tackle the issue of leprosy ulcers, which often lead to preventable disability. Dr. Indra has many years of experience in treating leprosy and is well placed to tell us about the impact of the pandemic on the medical side of leprosy. Dr. Indra has pre-recorded his presentation so that his internet connection does not interrupt.
Hello everyone, this is Dr. Indra Napit, Orthopaedic and Reconstructive Surgeon at Anandaban Hospital, the Leprosy Mission, Nepal. I have been working at Anandaban Hospital since last 13 years. Before we go to the topic, I would like to give some more information about leprosy. Leprosy or Hansen's disease is caused by bacteria called Mycobacterium leprae. Multi-drug therapy has been very effective treatment for leprosy, which is available free of cost in many countries. Leprosy is a curable disease and gives complete recovery if treated at early stage. It leads to complications due to delay in diagnosis and treatment in most of the cases. The most obvious complication is due to peripheral nerve damage in eyes, hands, and feet, leading to disability. Due to nerve damage, they also develop loss of sensation in these parts of the body, leading to ulcers. Chronic recurrent ulcer leads to disability and sometimes transforms to malignancy, ultimately leading to limb amputation. We all know that COVID-19 has affected all groups of people, including leprosy-affected people. In Anandaban Hospital, more than 600 leprosy-affected people have been screened for COVID-19 by RT-PCR test. A total of 39 people have been tested positive only at Anandaban Hospital. 23 of them have been admitted in COVID ward at Anandaban, and one died due to complications caused by COVID-19. Leprosy-affected people are a vulnerable group of people, and COVID-19 infection makes it difficult to take care of leprosy-affected people, especially those with disability. It has been reported that leprosy-affected people have faced discrimination while staying in COVID isolation centers. Here are major issues concerned with leprosy-affected people during COVID-19 pandemic. In some places, lack of MDT supplies at local health centers due to lockdown. Most of the health centers shifted their services to manage COVID cases, and leprosy cure was not their priority. Fear among leprosy-affected people to visit health centers due to beliefs that they might get COVID infection from there. Loss of income or employment, as many of leprosy-affected people work on daily basis. Forced to stay at home despite they have complications due to travel restriction and could not afford high-fare ambulance. Delayed diagnosis and management of leprosy and its complication, which leads to nerve damage and further disability. Some of the leprosy patients with reactions and adaptation drug hypersensitivity get into critical situation needing emergency treatment. Not all of them manage to come to hospital due to travel restriction and expensive transportation. Here are a few examples. This leprosy patient with type 1 reaction traveled for 2 days from West Nepal to arrive to Anandaban Hospital on expensive ambulance in May 2020 during lockdown. He was discharged after full recovery after some time. This leprosy-affected young boy had his leg amputated due to complicated ulcer a few years ago. Unfortunately, right leg had to be amputated last year due to badly infected fracture wound while he was on plaster for fracture treatment in village during lockdown, so he could not get access for specialist fracture care treatment. This patient was admitted at Anandaban Hospital and had to leave immediately due to sudden death of his wife during lockdown. So we arranged ambulance to go back to home so that he could attend cremation. Here is a short list of impact in leprosy services. New case diagnosis has been reduced Relapse diagnosis has been reduced. No active case findings since pandemic in many countries. Treatment gap due to travel restriction. Poor drug compliance rate of multi-drug therapy. Increased numbers of leprosy patients with disability. Services to leprosy affected people during lockdown. We provided continuous 24-hour services at Anandvan Hospital and also weekly leprosy satellite clinics even during lockdown. Allowed prescription of MDT for a few months before lockdown to minimize defaulter. Managed telemedicine consultation for leprosy patients online, especially with Zoom, WhatsApp, and Viber. Performed PCR screening of leprosy affected people in communities for COVID-19. We provided free COVID isolation ward services at Anandvan Hospital for leprosy and general patients as well. Performed distribution of relief items, masks, and sanitizer in communities for leprosy affected people during lockdown period. We performed online training on leprosy management to tele healthcare workers as well. We would like to recommend to perform active case finding campaigns in communities, organize health camps in communities for screening of leprosy and its complications in endemic districts, organize more awareness programs about leprosy-related disabilities, manage enough stock of multi-drug therapy and other essential drugs for leprosy management, request government to prioritize leprosy-affected people for COVID-19 vaccination program, disabled-friendly COVID isolation and care centers for leprosy-affected people with disability. For more information on impact of COVID-19 pandemic on leprosy services, please read the article published in June 2021, and we can follow this link. Thank you very much for your attention.
እንዴት አደራችሁ? እንዴት ዋላችሁ? እንዴት አመሻችሁ? ብርቄ እባላለሁ። እንግዲህ ኢትዮጵያ እኛ የስጋቤ ተጠቂዎች ኮቪድን እንዴት እንዳሳለፍነው መናገር ዛሬ ላይ ቀላል ይመስላል። በጣም ከባድ ነበር ለኛ። ማለት ለኛ ብቻ ሳይሆን ኮቪድ የመጣው በዓለምና በአፍሪካ በሙሉ ስለሆነ በሽታውን እኩል ቢያደርግም ግን ለኛ ለስጋቤ ተጠቂዎች በጣም ከባድ ነበር። የመስራት እና የመንቀሳቀስ የመገናኘት ስራዎችን የመስራትና ራሳችንን የማስተዳደር ችግሮች ተከስተው ነበር። እነዚህን ችግሮች ለመወጣት በችግር ውስጥ በነበርንበት ሰዓት ጄላሬ ኢትዮጵያ ኢትዮጵያና ብሔራዊ ማህበሩ ክልል 14 ጋር በመተባበር የምግብና ቁሳቁስና የንጽህና መስጫ የተለያዩ ድጋፍ በመደረጉ የተወሰነ ህይወታችንን ለማስተካከል ተሞክሯል። ግን በቂ አልነበረም። ቢሆንም ግን ይህንን ችግር ልንወጣው እንድንችል እግዚአብሔር ረድቶናል። እግዚአብሔር በጎናችን ነበረ። በጣም እንጸልይ ነበረ ለሀገራችን፣ ለዓለማችን። ይህን የምንሰራውን ስራ መስራት አቅቶን መሸጥም አቅቶን በጣም ከብዶን ነበርና አሁንም ቢሆን የተሰሩ ስራዎች መሸጥና መለወጥ በጣም ችግር ላይ ነን። ምክንያቱም የስራ ማግኘት መንቀሳቀስ ስላለብን በጣም ከባድ ነበረ። እኛ ብቻ ሳይሆን ሌሎችም ከስራ መፈናቀል፣ ቤት መዋል፣ ተማሪዎችም በትምህርታቸውም ላይ እንደ ሀገር እንደ ኢትዮጵያ እንደ ኮቪድ ያደረሰብን ጫና በጣም ከባድ ነበር እና እነዚህን እየተወጣን እያለን ሌላው ጎን ለጎን ደግሞ እኛ የስጋቤ አካል ጉዳተኞች ግንዛቤ መፍጠር ስለነበረ እነዚህን ግንዛቤ መፍጠሪያዎች ከብሔራዊ ማህበሩ ከጄላሬ አለርት እና ከኢትዮጵያ ቴሌም ኢትዮጵያ ከክልል 14 ጋር በመተባበር ግንዛቤ ለመፍጠር ተሞክሯል። ብሔራዊ ማህበሩ የሕክምና ባለሙያዎችን በማሰልጠን ለምሳሌ በሻሸመኔ ዙሪያቸው አነስተኛ ሕክምና እንዲያገኙ ክሊኒክ ተቋቁሞ ሴፍቲ ኬር እዛው አጠገባቸው እየተጠቀሙ ያሉ እንደሆነ ከሆስፒታሉ ጋር ያለው ግንኙነት እና ከአካባቢው ከመንግስት ጋር የስጋቤ ተጠቂዎች እንዳይገደሉ ራሳቸውን እንዲችሉ በመደራጀትና መብታቸውን እያስከበሩ እየተከራከሩ እንደሆነ በአዲስ ወጥ በተስፋዬ ወጥ እንዲሁም በሌሎች በክልል ዞን እየተዘዋወሩ ግንዛቤ ለመፍጠር ተሞክሯል። በቦሩ ሜዳም እንደዚሁ አባላት ተደራጅተው በብድር አገልግሎት እየተጠቀሙ አካባቢውንም እየጠቀሙ ራሳቸውን እየተጠቀሙ ይገኛሉ። የስልጠናዎች በተለያዩ ጊዜ ስልጠናዎች አሉ፣ የአቅም ግንባታዎች አሉ። በዚህ በአቅም ግንባታዎች እየተመርኩዘው ራሳቸውን እንዲችሉና መብታቸውንም እንዲያስከብሩ ለሀገራቸው ለወገናቸው ራሳቸውን እንዲጠብቁ ከአካል ጉዳትም እንዲከላከሉ ከአካል ጉዳት እንዳይደርስ ማለት ነው። በቦሪ ሜዳ ያለው በሆስፒታል ውስጥ ያለው ለስጋቤ ተጠቂዎች መጠቀሚያ እየተሰራው በወርልድ ሌፕሮሲ ዴይ ጥር አካባቢ የጎበኘነው ትልቅ ስራ የተሰራ አለ። ያው አሁን እነዚህ ሰፊ የተሰሩ ስራዎችን አሁን መግለጽ በዚህ ደቂቃም ስለማልችል ምናልባት ሰፊ ጊዜ በሚኖር ጊዜ መግለጽ እንችላለን ብዬ አስባለሁ። በተለያዩ ያሉትን ችግሮች እንግዲህ እናንተም ታውቃላችሁ። በእኛ መስሪያ ቤት ያለው ችግር የትምህርትም እና የዚህ የአቅምም ችግርም ስላለብን ድጋፉ እገዛ ለኢትዮጵያ ስጋቤ ተጠቂዎች ድጋፋቸው እንዳይለየን አዳዲስ በሽታን ለማግኘት ስክሪን እየተደረገ ተደርጓል። አሁንም እየተደረገ ስለሆነ አካል ጉዳትን ለመከላከል ጥረት እየተደረገ መሆኑን ያው በመጠኑ ነው፣ ብዙ ባይሆንም ጅምር ነው። እነዚህ ጅምሮች ደግሞ ሰፋ ተብሎ እንዲጀመር የእናንተ ድጋፍና የእናንተ እገዛ ያስፈልገናል እና እንግዲህ እናንተንም ከእናንተ ጋራም መስራት እንፈልጋለን። ኮንታክታችን በጣም የጠበቀ መሆን አለበት። ኢትዮጵያ ያለን የስጋቤ ተጠቂዎችን መደገፍ ማገዝ ከየትም እንዴትም ብላችሁ ያስፈልገናል እና ይህንን አደራ ማለት እፈልጋለሁ። ስራውን ስራችንን አብረን እንስራ። የስጋቤ ተጠቂዎችን እንከባከብ፣ እንደግፍ። ከችግር ከድህነት ከኋላ ቀር አስተሳሰብ እና ከተለያዩ ችግሮች እንድንወጣ የእናንተን ድጋፍ የኛም ጥንካሬ ያስፈልጋል። እንግዲህ እናመሰግናለን። አብረን እንሰራለን። እንወዳችኋለን። አመሰግናለሁ። ቻው።
We would like to thank Ms. Birke. Let me get the name right. I'm sorry. Birke Teka. She is a member of Ethiopia's National Association of Persons Affected by Leprosy, Nepal, and has worked closely with Ethiopia. In 2018, recipient of the prestigious Wellesley Bailey Award, which is awarded to honor those who have made extraordinary contributions to society. She has joined us via pre-recorded videos since she does not always have access to a reliable internet connection. We would also like to thank the Nepal team and team of TLM Ethiopia for helping us being able to witness her powerful words. She certainly gave us a lot to think about. I would now like to introduce another pre-recorded video, which comes to us from Nigeria. Asebe, Garba, and Mr. Hamisu Wazam are residents of the Amanawa leprosy community in Nigeria. We are aware that many persons affected by leprosy live in poverty and would not be able to a UN event that is taking place online and in English, as you've seen with Birke. Asebe and Hamisu represent many of those persons, and with the kind support of our team in Nigeria, we are able to capture some of the experience to share with you today.
The socioeconomic impact of the COVID-19 pandemic has pushed persons affected with leprosy into further poverty, with a more devastating effect on the women who already suffer from gender-based stigma and discrimination. The livelihood of persons affected by leprosy have been further impacted by the effect of the lockdown imposed by the Nigerian government. To control the spread of the disease, persons affected by leprosy are among the most neglected, and as a result, most of them were unable to access some of the palliative support by aid institutions, which were aimed at cushioning the impact of the pandemic. The Leprosy Mission Nigeria was able to mobilize personal hygiene, protective materials, and packages of foodstuff to over 1,700 persons affected by leprosy and other neglected tropical diseases. We spoke to some of the women living in the Amanawa leprosy community, Sokoto State, Nigeria. They shared some of the challenges they are currently facing as a result of the impact of COVID-19.
Shekara 80 amma shekara 20 da ciwon kuru. Ina sana'a sai Allah ka ciwon corona.
Sunana Hamisu sannan yanzu dai ina shekara 55 kamin rubutun nan ta zo lokacin da ta same dai yanzu dai shekara 30 to shikenan ina noma ina kiyo ina aski
sai ciwon corona gara Allah ka mun sai sana'a jari ko ne lalace mu ga mu nan ba mu sai inda muka saka mu sana'a ta lalace sai roƙo Allah muka niya zuwa ne ya dauko ni ya shiga mutane ina sai su amma yanzu abu ya lalace
to sai ga shi lokacin corona ta zo duk ta lalata abubuwa Amanawa da sauran wasu rere daban
sai addu'a mu san wanda za mu yi hidda kamar ga da ba sai roƙo Allah shi kama su kai muna ga wagga sana'a muna ɗauko kayayyaki muna sai da abin muna zuwa muna kai ana sa amma yanzu babu magana jari ya lalace zamna kawai mu Allah shi kawai muka sa gaba shi muna magani magana
to da haka muke son al'ummar mutanen ƙasar Najeriya nan su agaza mana domin mu ga cewa ga za mu yi mu tafiyar da ainihin al'umura abubuwan mu wanda za mu ciyar da iyalinmu da sauran wasu ɗaiɗaiku waɗanda suke ƙasa da mu wanda za mu taimaka musu da haka a yi ƙoƙari a taimaka iri yadda ya kamata domin mu samu ci gaba da rayuwarmu ko mu samu jin daɗin zama da jama'a. Assalamu alaikum.
Thank you so much for these powerful testimonies, and thank you to our Nigeria who made them available. It certainly gave us a and I would like to encourage you again to post your questions in the questions and answers box, and we will do our best to have them answered later on. Our next speaker is Mr. Faustino Pinto. Mr. Faustino Pinto is a person affected by Hansen's disease, also known as leprosy, and an activist and a leader. He is the Deputy National Coordinator of Morhan, which is the national movement for the reintegration of persons affected by Hansen's disease in Brazil. Faustino has been a speaker, a leader, an activist in Brazil and all around the world. We look forward to hear how the pandemic has impacted persons who experienced Hansen's disease or leprosy in Brazil. Please, Faustino.
Thank you, Mathias. Thank you, the Leprosy Mission, for this opportunity. The COVID-19 pandemic brought us fear, anguish, uncertainty, and showed us how fragile we are and that we are on a constant battle against the system that oppresses us. One wish to live a minimally decent life. I spent almost a year of my life trapped at home, fear for me and my son. In the hard times, I did go out. I went shopping and to the pharmacy. And when I got back home, I always thought I had been infected. That was sheer paranoia. I wouldn't watch TV or listen to the radio. The news weren't good at all and didn't even make us comfortable. I struggled to breathe because of the anxiety that filled my chest. Any changes in body temperature or a respiratory disorder had me think I had caught COVID. I would inevitably and constantly cry. Whenever I learned someone had been infected or died, it was like COVID-19 was knocking on our doors. And it seemed even closer when we actually knew the person who was infected. But what made us sad the most was knowing that the president of the Republic of my country denied the existence of the virus, made foreign relations difficult, and accused other countries of spreading the disease, provoked and encouraged agglomerations, laughed at the suffering of the Brazilian population, and recommended medicines without and proved efficacy against COVID-19. He did not negotiate the purchase of vaccines, witnessing all that before our eyes and in our country made us desperate. We could not believe in this harsh and cruel truth, but yes, that was what we have seen and are seeing in Brazil. So far, less than 20% of the Brazilian population got both the first and second jabs. The situation in our country is still of desperation. Then there came 2021 with great news in science, which brings hope for better days for everyone, especially for people affected by Hansen's disease. But we were soon surprised by the lack of medicine of Hansen's disease treatment. We then began to observe that the population affected by this disease was suffering much more than we imagined, not only due to the lack of medication, but also due to the lack of medical care, exams, dressings. Also, we need to talk to those people in order to understand what was actually going on. We used virtual social media for increased reach. We created a Google form and collected complaints from all over the country. We spoke with the Minister of Health to solve this lack of medicines problem, but yet that was not enough. The population affected by Hansen's disease needed more support from Morhan, the movement for the reintegration of people affected by Hansen's disease. Sasakawa Health Foundation launched a public notice for emergency projects. We saw that proposal as an opportunity to help more people. But for that, we would have to leave some of the fear that consumed us behind and go to the front lines against hunger and COVID-19. We created a COVID-19 safety protocol and started with field work as many as 5 Morhan nuclear in the seats of Rio de Janeiro, Vitória da Conquista, Belém, Manaus, and Juazeiro do Norte received Sasakawa Foundation support, while additional Morhan nuclear carried out humanitarian activities with other local partners. Please allow me to share some of our experience in Juazeiro do Norte, which is my seat. Not only did we deliver food and hygiene kits, we also provided home care. We were able to extend the project to 8 months with the help of other partners. During the home visits, we noticed that these families were completely isolated, had health problems caused by the lack of assistance and times of pandemic, and were fearful of contamination by COVID-19. As many as 4 of our patients in the project have serious health problems. 2 of them had their legs amputated and the other 2 have serious neurological problems. But we also have good news amidst the chaos. The extension of the project to 8 months allowed the patient to save some money and buy a vehicle considering he struggles to walk. Additionally, 2 patients opened a small vegetable selling business. We were incredibly happy to be able to help and give relief and care to some of the people who suffer from this disease in this pandemic. It's an ongoing daily battle because people are hungry for food, hungry for knowledge, hungry for living. There are people suffering. We did so much back in the day, and yet it seems like we did so little. But we do not quit. We cannot weaken. I was never told it would be easy, but I always knew that living is not easy. Living is about fighting for social and human rights. It's about resistance. Living with dignity is what people affected by Hansen disease want and need. Lawmakers need to understand that we are many and we are not weak. And for as long as life, we will fight. Thank you very much indeed.
Thank you so much, Faustino, for your speech. Thank you so much for sharing with us the experience of people in Brazil, which we know was also very hard and with many challenges. I want to now introduce Mr. Venu Gopal, who will be our next speaker. Mr. Venu Gopal is our partners in this event, Disabled Peoples International. He is a person affected by leprosy who lives in a leprosy colony in New Delhi. He is the Vice President of India's Association of Persons Affected. And please join me giving a warm virtual welcome to Mr. Venu Gopal. And we're very pleased to hear you now.
Good morning, good afternoon, good evening, everybody. I am Mr. Venu Gopal from India. I am attached with the Association of Leprosy Affected Persons Organization, APAL, Association of People Affected by Leprosy. I am in the service of our leprosy affected people since last 45 years. But this corona pandemic is very terrific and painful to our people living in India. The first wave, anyway, we have maintained a little better than the second wave. In the first wave, we have some medical facilities from the government and also from voluntary organizations, from ILEP and also local donors. But this time, we were in grave problems. We couldn't get any medical facility, even from the NGOs or government. As up to an extent, the ILEP agencies like Leprosy Machine has helped us by coming forward. And I know in this crusade, some of the employees expired. It is very painful than our problems. And on the other hand, due to lockdown, continuous lockdown in India, the people also face much problems for their daily food. Here I want to mention most of the population of our leprosy affected people depends upon alms and donations for their survival. During this time, our people bounded to stay at home and failed to have their daily resources for their food. And one thing I want to mention here, during the first wave, nobody has expired due to corona. Some of the people who were affected by this corona were recovered and are feeling well. But this time, many leprosy affected people affected by this corona, and also death toll was more than 100 during. So this is the situation, and then afterwards, our organization, Association of People Affected by Leprosy, had issued an appeal to NLEP to come forward to support as before. So after 15 days, NLEP agencies like Leprosy Mission, Saskawa India Leprosy Foundation, Raising Star Outreach, and some other local NGOs came forward and supplied some food kits for the relief of our people. And really, we are much regard without any problem. Now we are able to survive by having food. But actually, the 60% of the population of the world leprosy affected people is in India. There are 760 colonies. I know it is very difficult to cover all these people by any organization, but we have a little satisfaction as by Leprosy Machine we got MCR footwear, some medicine, ulcer dressing materials, and there are, but for I think one organization it is not possible to extend support to all the people living in India. And now, just after the relaxation of lockdown, our people are going out. On the other hand, I want to say this pandemic affected the education of our children also. The schools, colleges, all are closed, and online education started. But the people who has to go on roads for their food, how can they afford any laptop, tab, or the phone, Android phones? So our children badly affected to compete in future with other students of the community. This is very bad impact upon the education of our children. We don't know how they will cover. On the other hand, there are many disabled people suffering with chronic ulcers. Their children used to go for their jobs. They also failed. So in all ways, we suffered much by this pandemic, and we are hearing there is a threat of third wave. So I appeal our NLP agencies to get prepared to extend support in time if the third wave occurs in India. I am much regard to you all to have discussions about our issues, about the pandemic impact. Impact, totally I can say in a simple word, very, very, very bad for us. Thank you very much to give me this opportunity to express the conditions in India due to COVID-19 pandemic. And I hope we will recover. I have forgotten, sorry. And also our people, the able-bodied leprosy affected people, use it to work in their income generation projects. All these projects also stop. The inputs has drawn out in deep waters. I don't know how we can manage again in this regard. Thank you.
Thank you so much, Mr. Venu Gopal, for raising important issues, for reminding us, and for bringing them directly to the attention of everyone, what is happening, what is really happening on the ground right now, and has been happening during the pandemic in India. Please remember to ask your questions in the questions and answer box, and also tweet with the hashtag leprosy after COVID. I would like to go now to our next speaker. It is Mr. Pradeep Bhagival. Mr. Pradeep Bhagival is a Chief Technical Advisor at the United Nations Development Program in Laos, PDR. Pradeep has a long history of working on disability rights, having served across the world, including in Afghanistan, North Korea, and before joining the UNDP, Pradeep worked as the Leprosy Mission's head of advocacy. He is my predecessor. Welcome, Pradeep, and we are very happy to hear from you.
Thank you so much, Mathias, and a very good evening, good afternoon from Vientiane, Lao, PDR. I'm extremely sorry for having joined the meeting late, as I was held up with another critical meeting. Since I have just 5 to 6 minutes, let me say as an introduction that even under normal circumstances, persons with disabilities are less likely to access healthcare, education, employment, and to participate in the community. They are more likely to live in poverty, experience higher rate of violence, neglect, and abuse, and are among the most marginalized in any crisis-affected community. Now, I'm here to speak about how the COVID pandemic has impacted persons with underrepresented disabilities and how should we ensure their inclusion in any socioeconomic response and recovery. Now, persons with disabilities who are underrepresented are those who experience intersectional, multiple discrimination as a result of their gender identity, age, ethnicity, race, sexual orientation, origin, location, and legal status, among other factors, and also end up carrying a heavier burden of the immediate and long-term economic and social consequences of the pandemic. Persons affected by leprosy, persons with psychosocial disabilities, persons with intellectual disabilities, persons with disabilities living with HIV/AIDS, and older persons with disabilities are among those who remain underrepresented. Now, very briefly, let me highlight what are the challenges and risks that confront persons with disabilities who are from the underrepresented groups. First and foremost, persons with disabilities from underrepresented groups are at a greater risk of contracting COVID-19. Persons with disabilities from the underrepresented groups are at a greater risk of developing more severe health conditions and succumbing to COVID-19. They are also likely to live in institutions and are more likely to contract the virus and have higher rates of mortality. We have seen the example of persons, older persons with disabilities. It's very interesting to know that 46% of persons, older persons who are 60 plus, experience some kind of a disability. And also persons with disabilities from the underrepresented groups are at a greater risk of discrimination in accessing healthcare and life-saving procedures during the COVID-19 outbreak. We have heard many examples in developing countries where persons with disabilities did not receive the kind of treatment that they should have based on various issues like discriminatory practices. And persons with disabilities are particularly disadvantaged by the socioeconomic consequences of COVID-19 and measures to control the pandemic. Majority of the persons from the underrepresented groups depend on social protection programs and schemes, and there is a strong evidence to suggest that the regular social protection and social welfare support services have been disrupted, causing much hardship to those who are underrepresented. Now, as key recommendations, I would like to target local governments, and that's because the first line of contact for people affected by leprosy or those from the underrepresented groups who are living in poorer communities is the local governments. They are the first line of contact. First and foremost is they should ensure mainstreaming of disability in all COVID-19 response recovery together with targeted actions. This is something very important. Number two is accessibility of information, facilities, services, and programs in the COVID-19 response and recovery. Now, they should be made available in accessible formats for people who are underrepresented. Third recommendation would be persons with disabilities have the right to participate fully and effectively in all the decisions that affect their lives. Unfortunately, we find that even in Laopedia, when we developed our socioeconomic response, we did not consult people with disabilities, largely because they are invisible. We do not even have data on them. So having disaggregated data and to involve them is of critical importance. Recommendation 4 is accountability is essential for ensuring that the COVID-19 response and recovery is inclusive and respectful of rights of persons with disabilities. This is something that we do not see in many developing countries, and there is a strong need for accountability on the part of the government. Recommendation 5, as I mentioned, we need disaggregated data to understand the different ways in which people with disabilities experience the impact of COVID-19 and to monitor their inclusion in all phases of response and recovery. Ensuring the collection and availability of disaggregated data by disability is absolutely essential. Recommendation 6, ensure non-discrimination in the allocation of scarce medical resources. It is important to mitigate the risk of discriminatory decisions in resource allocations that put people with disabilities at a higher level of disadvantage. Many countries have anti-discrimination commissions, offices, and it's important to ensure that they remain highly vigilant and responsive to the complaints by persons with disabilities and their families. For instance, let me talk about India. My colleague Venu Gopal was talking about the situation of persons affected by leprosy in India. India has a very robust disability legislation, and every state has a state commissioner for disabilities. Now, it is their responsibility to make sure that the rights of persons with disabilities are protected. I have been following the news on a regular basis, and I did not see these officers coming into action and standing by people with disabilities during this humanitarian crisis. I'm not too sure how many states have actually appointed disability commissioners and how many of them are aware about their role and responsibilities. Next recommendation would be make mental health interventions inclusive of persons with disabilities. We have seen that anxiety during lockdowns, isolation, and information consumption, loss of livelihoods and support systems due to the pandemic has impacted the mental health of all people, including people with disabilities. Mental health and psychosocial support needs to be accessible and not discriminate against persons with disabilities. The last recommendation is to ensure the continuity of support services. Now, one thing that we see is people with disabilities, especially in developing countries, were having that social capital. What do we mean by the social capital? That is a network that is prevailing in the communities that support people with disabilities. For instance, if a mother has a child with intellectual disability or an adolescent or a teenager with intellectual disabilities, and if she is the sole breadwinner and if she is unable to provide that care on a regular basis, what she would do is she would request the community members to watch over her and to provide the necessary services. Now, COVID pandemic has disrupted this social capital, and persons with disabilities are severely impacted by lack of support in the community in which they live. So it's absolutely essential that, like in many countries, a volunteer force has been created, especially in South America, to support people with disabilities at the community level. Now, that is something that's required. As a conclusion, I wish to state that everything we do during and after COVID-19 crisis must have a strong focus on building more equal, inclusive, and sustainable economies and societies that are more resilient in the face of pandemics and the many other global challenges we are likely to face. This can happen if we ensure inclusion of the most marginalized and excluded group, such as persons with disabilities who are underrepresented. Thank you so much.
Thank you so much, Pradeep, for highlighting these important aspects that also are related to the CRPD framework and how we can better support persons affected during the COVID-19 pandemic. And I would like to thank all of our speakers and panelists for enriching our understanding and giving us so much to think about. And we would like to address now some of the questions that have been asked. And I would like to go to Dr. Indra first. There is a question from Subhojit Goswami. I might have butchered that name. I'm so sorry. It says, Dear Dr. Indra, did leprosy treatment come in the way of COVID-19 treatment or vice versa for co-infected patients?
Thank you very much for the question. Yes, there has been an article about the good effect of clofazimine, which is also called lamprey, because we all know that lamprey, clofazimine is anti-inflammatory drug. So when someone takes that drug, so they will have anti-inflammatory effect in whole body. So because of that, COVID-infected people who are taking lamprey have less inflammatory process in the body, especially in the organs like lungs. So if someone has pneumonia, so the effect of inflammation has been seen reduced in the patients who have been taking lamprey. So I read that article recently, so that's true.
Thank you so much, Dr. Indra. The next question is for Mr. Faustino Pinto. Faustino, there's a question from Charles Noafor from GLRA, and he's asking, you mentioned that there was a stock out, so there was a lack of medicines for Hansen's disease during the lockdown. What actions did your organization take to address that? Você entendeu a pergunta, Faustino?
O que a gente fez para resolver isso?
Para resolver a falta do MDT, do medicamento para a Hanseníase.
Ok. Mathias,
Você pode contestar em português, eu vou tratar de traduzir.
Ok, my dear. Então,
I will try to translate if he answers in Portuguese. Okay.
I have a difficulty speaking English.
Go ahead.
Do you know? Ô, Mathias, a gente pegou todas as denúncias e encaminhamos para o Ministério da Saúde e nós cobramos para que o governo ele fizesse com que essa medicação chegasse até os estados e municípios do Brasil.
So we reported all of the lack of medicine to the Ministry of Health, and so we did everything possible to, asking and demanding the government to make the medicines available to all of the states and to all of the local municipalities in Brazil. We have another question that has been, or it's a question and also has been mentioned as a wishful thinking, but I've seen it, and I've seen that Dr. Indra already responded in part to it, but perhaps it would be good to mention it again, that the WHO should perhaps include persons affected by Hansen's disease or leprosy as one of the priority recipients of the vaccine against COVID. Your opinion, yes. Dr. Indra?
Yes, I have already put that idea as a request in my recommendation also. I think leprosy affected people should have priority for COVID-19 vaccination programs in all countries. Even in Nepal also, I have also mentioned that to the authority people. So I think we should make official request for that, so that leprosy affected people, especially with the disability, can have as a first priority to get COVID-19 vaccinations in near future. Thank you.
Thank you. We will try to see how we can take that forward and advocate in a united front for that. There's a question about the best way to address the devastating effect of COVID on livelihoods. And I'm not sure if Venu is still around. Mr. Venu Gopal, are you there? If not, Pradeep, do you have something to say about that? The best way to address the devastating effect of COVID on livelihood? Yes. Oh, there's Mr. Venu Gopal.
I am here. I am here. Sorry, I am here.
Okay. Great. What do you think? What is the best way to address the devastating effect of COVID on livelihoods? Many people generally, and even more so, people affected by leprosy are losing their livelihoods. How can that be addressed?
Yeah, it is. I feel it is very necessary to provide the capital amounts again, because frankly, I want to say, whatever the amount with them during this COVID-19 pandemic, the people utilize it for their survival. But after having the support for the income generation project from Saskava India Leprosy Foundation and some other local NGOs, the people stopped to go for begging, and they were maintaining with dignity by earning by this project. They have the skill, ability, market, everything, but there is a need of the capital amount. I don't know how it will be possible. The people are actually, we are in contact with our people. They are repeatedly asking after this pandemic, they want to start their programs again for their livelihood. So the ILP agency also has to think. Saskawa India Leprosy Foundation has to think, and also we all together better to approach the government to get the support at a massive scale, because any organization can help up to an extent only, but not for all the people who lost their earnings. This is my suggestion. So if our country office come forward, Apple is ready to collaborate with you, and we can use both our sources to explain to the government, because there are many government schemes also. But we have to tell them what is the situation, what is the conditions due to this pandemic. It is very necessary. So there should be a concrete plan. We have to think together. That's my suggestion.
Thank you so much. I have a question now that is directly to Pradeep, and it comes from Suresh, whom you know well. How can we ensure that all states have a disability commissioner to be appointed and preference to persons with disabilities for being that commissioner? Yeah.
Thank you so much, Suresh, for asking this very pertinent question. It is very important to find out how many states have actually full-time disability commissioners. That's number one. Number two is Leprosy Mission in India is quite active with the members of the parliament. It will be of great importance if some of the members of the parliament are approached so that there could be a question asked on the floor of the parliament as to why there is a delay in appointing the disability commissioners. And also there are other opportunities like approaching organizations which can file a public interest litigation, which is something that's being done in India earlier by persons affected by leprosy and their organizations. That could be done. Draw the attention of the courts to tell them that India is now has ratified the Convention on the Rights of Persons with Disabilities, and they have a national disability law, and one of the provisions is to appoint state commissioners, and it is during these times that the role of the state commissioners is of critical importance. So there are various ways of means of advocating and to ensure that the states have disability commissioners. And most important of all, if I'm not mistaken, as on date, there is no chief commissioner for persons with disabilities at the Government of India level. That should be the first step to advocate and make sure that India has a chief commissioner for persons with disabilities. Thank you.
Thank you so much, Pradeep. We have another question that it says, do you think that people affected by leprosy face discrimination to access COVID vaccines? We have heard reports that that is the case in some countries. The UN Special Rapporteur on the Rights of Persons Affected has reported on that. Also, Pradeep, for you, from Nandlal Bastola, thanks for the nice presentation. Is there data available to reflect infection rate as well as mortality rate among persons with disabilities? I think it refers to the COVID-19 pandemic. Yeah.
If the question is asked in the context of law PDR, where I am currently the advisor for the Ministry of Home Affairs, I'm afraid we do not have this information. There is no disaggregated data, and whatever data is there is not in public domain. So this is where we lack information about the situation of persons with disabilities, and I am trying to push from the UN side to make sure that the governments, especially the Ministry of Health, comes out with this kind of disaggregated data and it's available on public domain for people to know what is the situation with regards to people with disabilities. Thank you.
Okay, we're nearing the end of our meeting, but the questions are coming in, so we got a good conversation going here. There's a question from Dr. Ashok Agarwal. Besides leprosy services, the leprosy affected in India also require basic support for survival like food. In rural settings, we have encountered huge vaccine hesitancy. Any similar experiences? I don't know who wants to take that one.
Can I add on this?
Yes, please.
It's
Dr.
not
Indra.
only among leprosy affected people, even with the general population also, there has been hesitancy on vaccination, especially at the first campaign when the vaccination was started. But after the second wave, now there has been panic in the community that people need vaccination, especially after some reports have been out that vaccinated people have a less worse effect of the COVID-19. If even they get infected, so they have mild symptoms or they don't go to ICU with a critical condition. So because of that, now it has been reversed actually. So a lot of people now want to have vaccination. But initially it was even in general population, like in other countries, even in Nepal also, there was hesitancy to get the vaccine. But now it's had been changed a lot. And I think many people now want to have vaccination. Thank you.
Thank you so much, Dr. Indra. There's a question from someone anonymous, and I don't know if we can answer to that, but I think it does reflect what is going on with the loss of livelihoods. It says, can you give the number? Lost a job. I think this is something that has to be addressed in every particular country. And these are times in which it is crucial to have that help, but it's also very difficult to get it, especially in some where the social network was not prepared for anything like this and was not prepared even before. Yeah. Dr. Ashok also says the RPWD Act needs to be fully implemented. I'm afraid I'm not sure what that act is.
Mathias, can I come in here?
And Dr. Ashok? Yes, sure.
Thank you. RPWD Act is the Rights of Persons with Disabilities Act, which is the Government of India legislation. And with regards to implementation, as I just now mentioned, it is important that we have a Chief Commissioner for Persons with Disabilities who is supposed to ensure implementation of the Act, and also the state commissioners. That is the first step. Number two is also it's important to draw the attention of the legislators to make sure that if there are any provisions of the Act is not implemented, to bring it to their notice. And thirdly, of course, as I mentioned, there are opportunities to seek justice from the courts. That would also be tried as a part of advocacy to identify which are those critical provisions. It could be right to health or right to education or right to livelihoods, and to ensure that the court's attention is drawn towards these provisions where provisions have not been implemented. Thank you.
Thank you so much, Pradeep. Thank you to all of you, the panelists. Thank you, Faustino. Thank you, Dr. Indra. Thank you, Venu. Thank you to our participants from Ethiopia and Nigeria. Thank you to our interpreters and also our live captioner. Thank you to our hosts who helped us. Thank you to Disabled Peoples International who also supported us in this side event. Thank you to all the people that you don't see but that are working hard to make all of this possible. And thanks to all of the participants who were there, who asked questions, and let us continue thinking and let us continue working for the dignity of all persons affected. I wish all of you a good day, a good evening, a good night. Bye-bye.
Thank you.